Everyone. Today we have Executive Director of Crossroads Recovery Center, Edgar Villa, joining us. Today Edgar is going to talk about addiction as it relates to substance abuse regarding alcohol and other drugs. Edgar, thank you for joining us.
Thank you for having me today. I appreciate it.
So Edgar, addiction. Today I know we're going to kind of dive in and really find out exactly what addiction is and the signs to spot it. So to start off, can you please give us a detailed definition of what addiction is?
Yes. Now, first thing I want to start off with is telling you what addiction is not, because there's a huge misconception between what individuals think what addiction is. One of the things is addiction is not a moral failing. It's not to do with bad parenting per se. It has to do with character flaw, or it has nothing to do with those things. The research has shown that in the last maybe 10, 15 years, that addiction is actually a brain-based disease. And the studies also further say that not only is it brain-based disease, but it makes fundamental changes in the brain. So it's difficult sometimes for family members to understand, my son or my daughter has a brain disease, how can that be?
Right.
Because we equate brain disease or a disease with a type of ailment that you can see, but with addiction, it's in your brain. You can't see it. And because brain controls your behavior, controls your emotions, and that might be a little bit erratic, people might think, well, no, my son, daughter just acting this way, but they don't realize that the brain has significantly changed because of this. So one of the things you have to look at is, in the part of the brain, there's actually a part called the midbrain. And that brain is where stores our emotional part of our brain, our amygdala, hypothalamus, which controls our memory. And what happens is we know that in that part of the brain is where the drugs get affected. And so there's a little loop that goes into the prefrontal cortex, which is the decision-making part of the brain. And the part of the brain actually, you would think, oh, it's something, say my mom gets angry at me, and then I think about it and I make a decision, yes or no. But when it comes to a drug addiction, it kind of bypasses that to the reward pathway where the person gets activated and wants to go use to resolve that emotional conflict or whatever's going on internally. So one of the things to look at is that the disease of the brain addiction has changed. That's one thing. So along that comes a continuum of problems because the brain controls your behavior. So now you're looking at behavior problems, compulsive behavior, which is doing something over and over until you get the same results. So think about it this way. You like your coffee?
I love my coffee.
You like your soda?
I love my soda.
Okay. Now, compulsive means is drinking your soda or drinking 6, 7 sodas a day. That's compulsive. That's the behavior we overdo it. And when addiction, that's when the trademark is the compulsive behavior. Another part that happens is obsessive thinking that comes along with the addiction process. And you start thinking over and over and over about this drug. Because remember, it leaves a print in your midbrain part of the brain on what makes you feel really good. Do you ever have any positive memories that you're like, wow, you think about it and they come back to your mind without wanting them to?
I do.
Think of that of addiction. Imagine that times 100. Multiply that, and that's how intense that sensation is. So it's going to come about. So a lot of things, another trademark of addiction is cravings. The individual does not have control over cravings. It does not. He or she does not say, I want to think about using. So another aspect is the craving is a physiological, psychological, emotional response the person has when either think about it, whenever they see something reminds them, when there's an emotional attached. It's just going to trigger that craving response. So that's one of the components when it comes to what is an addiction. There's more aspects to it. There's also what we call addictive behavior, where that comes along, any behavior that we do in order to maintain our addiction or our using. And there is a continuum when it comes to addiction. You could be at one spectrum where you think about all the time, do all different behaviors, or you're at the lower part of the spectrum where it's pretty much just abuse and recreational use. So, I mean, there is a far degree in between, and sometimes as family members, we don't know how to classify this.
Right. So that's interesting. It sounds like the brain really is affected by the drug, and it really changes the individual in every sense of the way.
Yes.
So they have no control whatsoever. And so going back to the definition of what addiction is, so it produces this pleasurable memory or sense or feeling for the person, and it causes them to have these compulsive behaviors. But at what point is it considered an addiction? Is it considered an addiction only when it starts to interfere with something, or at what point is it considered an addiction? Because there are people obviously that use alcohol or drugs and are having compulsive behavior, but at what point is it considered an addiction?
You said something really important before your question, which was control. They can control their behavior. That's one of the things you start noticing initial signs. That one initial signs is you have difficulty controlling, which means is I'm only going to drink 3 or 4, but then you actually drink more than that. You little by little, what you're doing is you don't realize it, but as you go along, your ability to actually make the decision how much you want and how you're going to take it is being diminished little by little. So that's how you start knowing something's going to becoming a problem, is that your initial control that you had before no longer is there. The second thing that happens is that your brain starts to desire it, to look forward to it, to the next time around. And that's when you start noticing, okay, all of a sudden you're excited about Friday, here comes Friday, or here comes Thursday, I want to see this person, because you know your brain has already had the little alarm saying, ding, 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 and the reward's coming. And that's how you know that an addiction is developing. And the second part of this is the problems associated with it. You miss your obligations at work, at school, with family, different functions you don't attend to. So yes, that's when you start noticing that you're actually replacing one with the other. So you start, because of your drug using or alcohol drinking, what's happening is now you're failing to meet certain obligations, whether even it's just waking up on time and you still make it to work, but now you woke up late because you drank a little bit more today. And I'm not saying just one time. I'm talking this is an occurrence. Now it's happening a few times in a month. It went from maybe once a week, a few times a month. And so that's when you start noticing the pattern that's incrementing or increasing.
Okay, thank you. So it sounds like this is starting to interfere with some aspect of their life. That's when it's considered to really be an addiction, when the addiction starts to affect either their family life or their education or any of their responsibilities. Is that fair enough to say? And so can you tell me a little bit more about the effect on the brain? I know you kind of dove into what part of the brain that starts to get affected, but what are kind of a little bit about the biology that goes on in the brain and what exactly happens when they start to become addicted?
All right, that's actually a really great question. A lot of family members asking me that question because they can't understand what is the disease in their brain because they can't see it.
It's hard to grasp because I think as a family member you look back and you're thinking, I just see this person drinking all the time or using this drug and that's why they're doing it and they're the ones that are doing it, but they don't necessarily see that it's the brain and whatever disease is going on that they have. So yes.
So this is what happens, just to put it in very best terms as possible when I'm educating the family members, is that we have brains, right? And in our brain we have cells. And think of these fingers as different cells, receptor sites that receive every time something happens, whoop, releases chemicals, this receives it, you feel good. But what happens is we have dopamine, serotonin, GABA, all these different neurochemicals in our brain that makes us feel good. So what happens is when naturally we already have dopamine in our brain. So when we eat something, when we do something we enjoy, the brain naturally releases dopamine. Boom, the brain receives it, feels really good. Now, think about this, is that when you use methamphetamine, for example, is now not only do you shoot that dopamine, but you multiply it by 100. And what happens is the dopamine, when it comes to meth, it blocks it. So sometimes whatever does it get used by this, it comes back up. But now imagine you only release 10 of these dopamines. Now with meth, they say you release 1,000. And before is the 100 would come, whatever wasn't reused would come back. But now what meth does, it blocks it from coming back. So guess everything has to go where? This one. So you get a huge response. He's going back for. That's what meth uses. That's a long time. So what happened after a while? Our brain wasn't developed to handle those kind of things. So what happens is this gets shored up. So instead of having all these, now you only have maybe these two, and that the brain is changing little by little. So that increases tolerance. that causes withdrawal symptoms. So that's what the brain's going, and the withdrawal symptoms comes irritability, impulsive behavior, all these different things with the withdrawal symptoms, and that's where the brain is actually changing, because you don't have the same brain that you did before. The neurons are affected in a way that you don't have enough, so when you do something, you don't enjoy it. And that's where the addiction takes place, is something you can't see, but it happens.
That's interesting. Can you tell me a little bit about also the dependence that is caused? So I know we talked about restructuring the brain and how the brain changes, but the dependence on this drug. So obviously they're getting this feeling, kind of this inertia, and they want to keep going back for it because it's so pleasurable. But what kind of psychological or physical dependence have they established by using this drug or alcohol?
So typically, to get a good dependence takes a good maybe 3 to 6 months.
Is that for anything, for drugs,
pretty
alcohol?
much, if you do it on a
anything?
consistent basis, 3, 4, 5 times a week, your body will depend on it. And what happens, I give the example of the brain. Well, what happens is, because now you have this much coming in, receptor sites, now what you're doing is your body now needs an outside source for dopamine, which is methamphetamine, to continue the same level of function, the same high. Mm-hmm. So that's where the body becomes physically dependent on it. The second thing is, emotionally speaking, is whenever you feel down, the brain is going to want it, so it creates a dependency. So that's what we're talking about when it comes to physical dependency, is that not only that, then your body also starts to need it physically. So a lot of people won't realize it, and that's when the individual will tend to lie, cheat, steal, or make it seem like they don't even care about the family members. It's because they don't care about the family members. It's simply because the brain has equated drug use to survival. I need this to survive. And if you're my family member, you're getting in my way of my survival. Without this, I'm gonna die. My body's gonna feel like it's falling apart and aching and whatnot. And guess what? It goes to survival mode, and they wanna continue to feel okay. I mean, that's where the physical dependence comes in. Sometimes they get to the point that they're just using it just to feel normal. That's the physical dependence when it comes to addiction. And family members don't understand the aspect of it, or it's difficult for them to understand, well, they're taking it themselves. But there comes a point where you kind of lose control. There comes a point where your brain, what we call it, gets hijacked. And now the drug is taking over, and your decisions are based on what the brain wants, which is more of the drug to keep what we call the homeostasis, the balance in the brain.
I think you hit a really important target when you said that the brain uses it and the people feel like they need it. It's getting in the way of their survival. I hope that the listeners out there are really able to kind of grasp that and realize that that's what their loved one is going through. It's really affecting their sense of survival. And I think that's a good way to educate people, because I know a lot of people that have seen their family members suffer through addiction, and it is hard for them to really understand what's going on. So I think the way you described it, getting in their way of their survival, that's kind of hitting it head on and helping people to understand what's going on with the addiction. Mm-hmm. So now, another question that I heard before is regarding addiction. How do you know if you're getting blackouts or flashbacks, does that mean that you have an addiction, or is there kind of a set time? Or a lot of college students, tend to binge drink. So are they considered addicted to this alcohol or other drug that they might be using? What can you use to kind of guide people to realize whether or not they have an addiction?
Well, one of the things is, first thing is that call a professional and ask these questions. That's the first thing, so they could give you the proper information based on your individual case. That's one thing I recommend. The thing is with college students, binge drinking is usually, 5 to 6 drinks within 1 hour is usually a binge drinking session. That doesn't mean you have an addiction. So anyone out there that is binge drinking, it doesn't mean you have an addiction, okay? It just means that you're drinking a little bit too much for the time you have allotted for yourself. Now, when it comes to blackouts, it's a little bit different. With blackouts, just means that because as you're drinking, the alcohol level content in your blood is increasing. And so what happens when you drink too much, because usually it takes 1 hour for every drink of a 12-ounce beer, which has the alcohol content, either 1 glass of wine or 1 shot. It usually takes your body 1 hour. What happens is when we have blackouts is we drank too much that our body can't process it, enough. So it reaches a point that we're going to have some form of blackout. And blackout doesn't mean you don't remember the whole night. Blackout means that from 7 o'clock to 7:30, I don't remember what happened. Or from 8 to 8:30, that's one level of blackout. And then we have a whole blackout where you don't remember the whole night. So that doesn't mean you have an addiction. It just means that at that moment, you're drinking excessively and too much for the body to handle. Now, with an addiction, it's different. With addiction means that you're doing this 3 or 4 times a week, 5 times a week. You have constantly negative consequences, and you still do it despite the negative consequences. You still do it even if you fail your obligations. You still do it even if you know that it's potentially harming you. That's what an addiction is. You kind of lost a sense of control, and you're looking for the next time. Even though you wake up feeling bad, you maybe got into legal problems, you wake up, okay, I need to get my next drink. I need to get my next fix. I need to get my next use. That's the difference between an addiction. And there's progressions to it. Doesn't mean that it's all on the extreme. You can still be addicted to something and still somewhat function in society. Even though it seems like it's a contradiction, but little by little, as you continue using, eventually you'll not be able to function because you'll be consumed by your whole time wanting to do this.
So when you talk about the different levels of addiction, so you're saying if it's affecting one of those factors regarding your obligations, responsibilities, that's when it's an addiction. But some people, they focus or work at a more extreme example, so it just consumes them, and then there's a lower level where it's just interfering with my job or it's just interfering with my family obligations.
Think about this like a check-off system, okay? So have you ever gone on these magazines where it says, does my person love me? And you're check. Oh, he loves me a lot, right?
Right.
So think of this check-off system as kind of the same thing where you have a list of 10 different things, right? And that's how many you check off will determine the severity of the use for alcohol or drugs. So one might be is using more than I intended to, check. Didn't go to work because of drug using or alcohol, check. Family problems, check. I'm having cravings, check. I have more tolerance, withdrawals, check. So the more you check, the higher degree of your addiction is. The more you're willing to put at risk because of it, the higher it is. So that's kind of, you want to look at the checkoff system. So it's really easy to say this person is addicted because they're losing control, but we all lose control once in a while. That doesn't mean it's more in the classification of the severity of it. That means from really addicted to non-addicted, that might be maybe 1/4 down the way. That's why you really need a professional to evaluate you. That's what you really need to talk to someone that really could ask you certain questions to give you a proper determination what level of care you need. And that's something we do at Crossroads Recovery Center. If not with us, please call someone and locally and ask to see if you could be consulted with someone, talk to someone, because that's where you get your real information from. So it's not a exact science.
Right.
What I could see as an addiction, the person might say, well, he's almost in an addicted phase. I mean, that's the thing about it right now. In the field, there's some individuals that might consider it, some of them not consider addiction, but for the most part, there is somewhat of a standardized way of evaluating to see that if this is addiction or not.
And as it relates to addiction, is it fair to say that certain individuals have a higher chance of addictive behavior or having an addiction with alcohol or other drugs? Is there certain individuals that qualify? Well, can you tell me if there are, and if so, what causes that?
Good question. If we go back to the questions, is nurturance or nature nurturance, right? Well, we know that there is some individuals that are predisposed, which means, doesn't mean they're going to develop it, but they have these genetic markers, or they have this, we call it this vulnerability, where if they use and they have a history of it in their life. So let me back a little bit. So they have a history of family members that have used and they have developed addiction. That means they might have a vulnerability. Because what happens is, the younger you start using, the higher likelihood of developing a dependency addiction is going to happen. So that's one, because the brain will be changed by the drug and alcohol use. And the studies have shown that between 30 to 40% of addiction has to do something with somehow a vulnerability, some genetic factor. Usually 60 to 70% has to do with the environmental factors that will make a person predisposed to doing that. So now if you already have the genetic factor into here, or the vulnerability, then you add an environment you grew up in where they foster that type of behavior and they're okay with it, that's a great recipe for that to happen. Now there's also psychological determining factors that they use, for example, the type of attachment you have. Some individuals, depending on attachment theory, states if you have an insecure attachment, which means that you have difficulty connecting, bonding with individuals, you're very anxious and whatnot, you're more likely to want to use alcohol and drugs, and that's a different type of theory. But we're looking more at the nurture virtue nurturance, which means that, there's individuals that are more likely. Some individuals that drink it the first time, use it the first time, and all of a sudden your brain goes, ooh, I really love this, and they use it. Other people might use the same drug, say, that's not really for me, I don't like it, and they don't use it at all. So yes, there is a genetic factor to this. There is a part to it. This is not just like, I've never met anyone that says, I want to become an addict.
All right.
No one ever says that. I've never met anyone like that. Maybe in my future I will, but currently I don't, or I haven't.
Okay, so there's genetic factors that kind of take place, so the biology of the individual can increase the likelihood of addiction, and the environment, if it really fosters. So can you tell me about the environment? What kind of environment, when you say the environment that supports that addiction, what exactly are you talking about?
Good question, because some parents tell me, well, my son, we grew up in a very good environment. There was no abuse, no violence, none of that going on. What could happen? And you know what? Sometimes what happens is you don't have to have a horrific background. You don't have to have a bad lifestyle. You don't even have to be neglected as a child or abandoned as a child. What happens is you go to high school, you meet a friend that says, let's hang out. You take a few drinks. All of a sudden, you had a good time. Your brain remembers, this was a great time, I had a good time, enjoyed myself. There were no negative consequences. Next time it happens, do it again. And what happens, it's like enough time that you do this, your brain starts adapting to what's being input into the system. So your brain starts changing little by little. So that could also happen, just out of no type of abuse or whatnot. So that's one of the things that happen. So out there to parents that you think you did something wrong to your child, one of the things that when they teach in Al-Anon is you didn't cause it, you didn't cure it. So which means is whatever that has gone through them it's their way of coping, whoever they are. And one thing you have to understand is with Crossroads or any place you go to get education, they'll teach you these things, the support that you need sometimes. Because as family members, we kind of want to blame ourselves. If I didn't do enough for this, I did this too much. But that's one thing I want to come across today is letting you guys know, everyone out there, is that there's different things. There's a lot of things we could have done, we should have done, must have done. But it doesn't mean that we caused the addiction. Some things are totally far out of control. Now there's other things like, for example, that predispose someone in an environmental factor, which is if there's domestic violence in the home, poverty level. That also affects the type of attachment you have. You have a parent that is attuned to you, listens to you, encourages you, emotionally teaches you certain words and to express yourself, you're less likelihood to have that addiction develop or predisposed to having that. But if anything is it's really difficult to say who will become an addict, who is not, but studies have shown that certain environments create a higher likelihood. Doesn't mean that's going to happen. However, we also know that there's also safety guards on here. For example, if you grew up in a certain environment, poverty level, but you have at least one person in your life that is nurturing, caring, guiding the right way, that decreases the odds of developing mental illness and also developing substance abuse problem.
And I love the way you said that doesn't necessarily mean that this person is going to have an addiction. It might increase their likelihood or their vulnerability, but that doesn't mean that they have to have that path or that future set for them. As far as development and mental health disorders too, does that also increase the likelihood if somebody's suffering from anxiety or depression?
Good question. Now, one of the things you asked is distinguishing substance abuse with a mental illness. Actually, substance use or addiction or substance use disorder is actually part of the mental illness. It's part of the mental illness spectrum. So it's not one or the other. When you have a substance use disorder, you have a mental illness because the brain has changed. That's one of the things. Now, of course, if you're putting something into your system that is changing your biology of your brain, your dopamine, your serotonin, it's depleting your brain cells, you are more likely to develop depression and anxiety disorders, even maybe some schizophrenia, and might be a drug-induced schizophrenia. Once you get it out of your system and you're sober, all those might go away little by little, or they might stay there. We don't, it's really hard to say depending on the genetic factors. If your family has history of schizophrenia or other mental disorders, that's what's going to happen. But yeah, I mean, it's just one of the things you have to look at is just that some people won't develop. And once you get rid of the drugs, you could see if this depression was really pre-existing and was just made augmented, made worse by the substance use, or you could say it was caused by the addiction once it's treated and it's gone.
Can you tell me about, we hear a lot of the times that substance abuse or, any kind of addiction is a disease that's going on in your brain. So there's this idea of a disease, and a lot of family members, when we think of family members, friends, or what have you, of loved ones that are suffering from addiction, we think of disease. When I think of disease, I think of somebody that has suffered from, a disease that they're going through some kind of treatment for, some kind of medical treatment. So when related to addiction and drugs and alcohol, it's really hard to grasp that as a disease. Can you explain how the addiction is really a disease in your system?
One of the things is, one thing you said is there's medication for high blood pressure.
Right.
There's medication for insulin, diabetes individuals.
There's procedures, or there's something
protocols
that people,
in place.
right.
But if you notice, every medical problem has a behavior procedure component to it. When you have high blood pressure, when you have maybe diabetes, there's also behavior things you have to do. You have to go for a walk, change your diet, eat certain foods, not certain foods, because it's going to elevate your insulin. Correct?
That's true.
But same thing with addiction. Addiction, there's a lot of medication out there for that. There's methadone for opiate use, you know what I mean? There's, for alcohol, there's certain drugs you can put on your system where if you drink, it's gonna make you, make you nauseate and stuff like that. So there's different type of things for different with Suboxone. There's a lot of different type of drugs that are medical procedures. And like anything, there's some medical diseases that respond really well to behavioral components to it. And that's what we have to look at, is just that not only an addiction can also be treated through some medication, but also can be treated through a therapy individual. For example, another thing is, we know PTSD changes the brain.
Right.
Right? There's no medication for PTSD. You know what I mean? As far as, when I've talked to psychiatrists, they say, there's no medication for PTSD. There's some things they could probably do for it. They could treat maybe the depression, anxiety associated with it, but for the actual PTSD, it's hard to treat. So same thing with it, just because there's not a specific drug for it doesn't mean it's not a brain disease. It hasn't been affected or changed. And that's one thing I want to let the family members know. It's really hard sometimes to understand the concept. I want to make it really clear. For example, say I have my heart. It's not functioning well. I'm going to take a little 80 milligrams of aspirin or Tylenol to make the blood flow a little bit more. So I have this going on in my heart. And the doctor also says, besides this little pill, you need to exercise, eat better, manage your stress, do things you enjoy, all the different things to make me feel a little bit better. And you could see that. Now with the brain, it's kind of the same thing. We encourage them to do their meetings, work on pre-existing maybe concerns that they had or problems they have, learn how the brain's affected, learn what relapse prevention, learn all these different things in order for them to be able to heal their brain, because we know that with time the brain heals itself. We know because of neuroplasticity and the way the cells of the brain, we're able to make new connections and whatnot. We actually could tell the brain is healing. So there's definitely a treatment to it. If the client or individual stays sober enough, they could heal their brain. And it's what you eat, exercise, the social relationships that you have, all that heal the brain. And so, yeah, there is a treatment component to it, but sometimes we don't word it that way. But studies have shown that there is different things we could do to heal the brain.
That's interesting. So you really do treat it like a disease. Like you said, if you have high blood pressure, it's kind of the same concept where the individual has to seek the treatment and improve their relationships, improve their mental health, and rid themselves of the addiction, the drug, alcohol, or whatever the case is, and thereby their brain will heal.
Yes, another thing is I hear the whole concept of relapse. They went to treatment and they came back and they used.
Right.
And so that treatment place didn't work, or they didn't really want it. Do you ever tell someone that is diabetic and go sneaks a cookie and says, you relapse, you're bad? That doctor doesn't know what he's doing. We don't shame them because we know that happens, Same thing with addiction. We're going to relapse. When you have cancer, the doctor doesn't say, you're cured. They say you're in remission, and they monitor you for a few years, a lifetime, just to make sure it doesn't come back. Same thing with addiction. They're in remission. It doesn't mean they're cured, their disease is being managed, and it's a lifetime management. They have to incorporate in their lives. And along the way, sometimes they might stop doing the things that help them stay in their sobriety. Same thing with someone that has cancer or other diabetes or whatnot. They might sneak something in here and there. But that's the thing you have to look at. It's a disease that has to be treated for a life. It's not something that you go for 6 months, all of a sudden you're better and that's it, and you're never going to use again. That's unrealistic. You have to look at it as a long-term effect. So family members, if you have someone that goes into treatment, and just because they relapse doesn't mean they're actually going or failed. It just means that they have to learn more skills. Maybe they have inadequate skills. It just means that they might have to continue to do what they were doing before to get back on wherever they stop. And a lot of people think, well, relapse is part of the recovery process. It is at times, but it doesn't give it a reason to relapse. It just means that if the person is working what we call working a program, which means doing the behavior components, psychological components that for treatment, is that there is a possibility of them relapsing. But the goal is a relapse is to have what we call a successful relapse, which a lot of people say, well, how can that be a successful relapse?
I'm looking at you thinking a successful relapse. Well, that's pretty much telling the person that it's okay to relapse as long as it's a successful relapse.
A successful relapse for us means that when you use, you stop it just at one use. You learn from it. You grow from it. You say, I need to watch out this again.
But I mean, especially related to certain drugs, your one-time use, people could overdose.
That's a good point. A lot of people say, well, it is not that we're saying go out there and relapse, but we're saying we understand that people are going to relapse, but we're not going to shame them. We want to reform that says, okay, let's make this something you can learn from. This is something you need to grow from. I mean, we don't say, well, have a successful. We say, let's plan for potential relapses. If that happens, who are you going to call? Who can you call after you use? Who can pick you up? Who can provide you a safe environment if you do relapse? That's what we call is because we prevented that person, especially with an addiction. One use might lead to weeks, months worth of using. So we could stop it at the first we call it the first hit, the first time. Then they've been treated successfully. Okay. Think of this as a person that has diabetes, or has some type of condition where they have this flare-up. And if the doctor could prevent it from getting worse, well, what does the doctor call it?
Well, that's when the doctor steps in and treats them.
This is called a successful intervention. What is the difference? It's we have to go away from the morality of addiction. Right. We have to go away from that is a character flaw, and look at it more as. And that's what I'm saying. As you're asking me these questions, it's really easy to say, well, how you're saying okay. No, what we're saying is we want to do an intervention that is successful, and a successful intervention is preventing it from getting worse and learning from it and moving on, and planning that ahead.
So Edgar, as you're telling me about the successful relapse, I'm kind of going through it in my head and trying to really grasp my head around it, because there's still a little part of me that's thinking if I have a family member or loved one that's going through an addiction, I'm not going to say like, okay, it's okay, you had a successful relapse. There's still, and you're right, there's a lot of shame that goes with it, because you throw up your hands, we just went through all of this recovery, and here you are doing it all over again. It didn't work. So what, I guess, words of wisdom or reassurance can you provide to those family members that are going through that?
You say, you know what, son? I'm really happy that you're able to stop yourself from going down that path, and you really got the help you need at the time that you did, and that you learned from this relapse. I'm happy that you didn't take it to another step. Some people call it lapse in their recovery, not an actual relapse, but a lapse. And I'm glad that you're able to do this for yourself, and you learn from it. That's great. You don't have to call it successful. We don't get tied into the word successful. We're tying in more that, did you learn from this? Did you grow from it? Did you stop it? They were able to control this disease. You have to look at, they were able to stop themselves when before they couldn't stop themselves the first time. They stopped the progression, because we know that the progression continues. As you stop and you go back into it, it progresses back into where you left off, or sometimes even worse.
So when you talk about kind of having a plan for relapse when it happens, is it kind of safe? I'm trying to wrap my head around it. Is it kind of safe to say that it's almost like having an insurance plan? If I have insurance because if I ever get in a car accident, I have means of taking care of my car, vehicle, or any kind of injury. Is that kind of the same thing, having a relapse plan? It's kind of like your insurance. If anything ever happens, you have this plan going forward of what you're going to do, what's going to happen.
Yes, now give you an extreme case scenario. For example, say we have a 7-year-old woman that's living home alone, has a history of a heart attack. She might get a little template with a little button that says a quick response, right? That's an emergency plan. If something happens, she pushes the button. Same thing when it comes to addiction. Also, when you go to a doctor, you have a heart problem, heart attack, she's going to give you a plan, or she's going to give you a plan of what to do if just in case this happens. Call 911, all these different things. Not only does it give you preventive measures, which is take certain medications, follow this regimen, but also in case these don't work as effectively, let's do something if you have a problem afterwards, a heart attack or something of the nature, so you know who to contact, when to contact, how soon to these things. Have a list of medications, so when the emergency response team comes in, they know what you're doing, what's your medical condition. That's what you're preventing. Doesn't mean, well, I'm pretty sure you're going to have a heart attack, so let's prepare. You're not setting them for fail. You're setting them for the worst possible outcome, what to do to prevent them from dying. Because the ultimate path to this is death. So we want to prevent that.
Right, right. And then just to kind of step back, when you talked about recovery and how it's a lifelong process. So when people say I'm a recovering addict, that really is something that they're spending their whole life on that path towards recovery, and it's a lifelong commitment.
Think about this. It's when you're on a diet, right? You eat your food, you're on a diet, watching what you're counting your calories, then you stop. And then what happens when you stop counting and following that regimen?
Then you start to gain weight.
And then all goes wrong. What I'm letting you know is this, is when you're eating, it's the same thing, is you don't want to have a diet and restrict yourself because you're going to want it more. You want to eat to fit your lifestyle. It's a lifestyle that you're having. So think of recovery as a lifestyle. I am able to do this, but I know I'm able to do this. So I'm not thinking so much as that there's nothing wrong with being all in recovery, but I'm saying it's a new lifestyle. When I mean lifestyle, means they're sleeping now at the times they're supposed to be sleeping, or regular times, regardless of 8 hours sleep, whatever time they're sleeping. They're eating their meals. They're socializing with people. They're being of service to others. They're going to church, and they're working, paying their bills. That's a lifestyle.
Right.
So we want them to change their lifestyle when that lifestyle decreases the possibility of them relapsing. And that's what we're looking for, is a lifestyle change. When that lifestyle change comes an attitude change. And with that comes this realization that you are part of something greater than yourself. That you are part of this community. That this is what you're doing to yourself does not only affect you, it affects everyone around you. If you're healthy, everyone benefits. If you have a healthy lifestyle, everyone benefits. Your family benefits. And that's what we're looking at, is a lifestyle forever. And in order to maintain this, you have to enjoy, be happy in your lifestyle.
So it's really a lifestyle, lifelong commitment, and kind of reestablishing the lifestyle to fit and to work towards recovery for the rest of your life, so that they can remain sober and free from their addiction.
Yes.
Can you let the viewers out there know, as it relates to addiction, what are some of the warning signs that your loved one is, suffering from an addiction? What can we look for as parents, as spouses, as just loved ones?
Good question. I get asked this a lot. Some parents come and tell me, Edgar, I wasn't even aware that my son, daughter has an addiction. One of the first things I look at is their grades, their attendance at school. That will tell you a lot. If your child all of a sudden is grades are going down, you're not getting good report cards, that's an indicator that something is going on. Another thing is they might not be sleeping at night, they're coming home late, eyes a little bit reddish, certain smells. Don't hesitate. I'm not saying overreact, but I'm saying don't hesitate. Ask the question, have you been using alcohol or drugs? And test. There's tests you could buy at local stores to test your child. Is it invasive? Is it invading some privacy? Yeah, you're a parent. They're your children. You want the best for them. You want the information. You work with facts. It's like Ronald Reagan said. Is trust but verify. Trust your kids, but also verify. Talk to the teachers. Take drug tests for them so they know that you're on it. So that's one of the first signs to start seeing what's going on. Another sign you can see is people are not showing up on time. They're missing work. They are emotionally more erratic. That means they get angry a little bit faster. And this is out of their character. If they're already angry, they're angry. And that's the opposite. Some people get really angry, all of a sudden they're more mellow, more they out of their character, and they haven't gotten any therapy. Something's going on. If they're oversleeping at night, so those are little indicators that lets you know that something's wrong. If you notice any behavior change with your child or a loved one, that also could mean that there's some type of addiction going on or some drug use. So you always want to ask when you notice those little changes.
So those are really good things to look out for. So a decline in their grades or sleeping pattern or their behavior, whether it be erratic or angry or just a shift in who they usually are.
Another thing is their eating pattern changes. They don't eat as much or eat too much. That's what you're noticing also. Because normally when people start using drugs, they start changing their schedule, their behavior starts being a little bit different. You start noticing those changes. They're not consistent anymore. They're very inconsistent. Last thing with parents is also who your child socializes with will tell you a lot. If you start noticing certain children that look a certain way that might strike for you like a warning sign,
right?
That you might also consider that, especially if you notice behavior change, that could also happen. I had a client that her daughter was taken away because she became really angry, would fight back to her mom. And as we traced back in therapy with her, she started realizing the little areas that she didn't catch, like the friends, grades going down, not waking up on time, not wanting to eat. All of a sudden, she didn't like doing things that she enjoyed before. Those little changes, she didn't catch on, and she didn't catch on until Child Protective Services was called and the child was taken away because of behavior issues, not going to school and stuff like that. And that we want to be able to prevent all that. And she's like, I wish I knew what I know now, Edgar. I could have been preventing stuff. Yeah, when we look back at things, our vision is 20/20. We could see everything, but sometimes if you get just educated what the symptom warning signs are, it could help you a lot.
And that's why I think it's great that you're here sharing with the viewers all of this information. So hopefully, even if it reaches out to one person, to really be able to see the warning signs and what to look for and to help them to get that help, whether it be with Crossroads or with just another mental health facility that can help them through this addiction.
And I'm glad you bring that up, because one thing is, if you have suspicions that your child, loved one is using, there's a reason. There's a little thing in our system that gives a little warning sign that something is off. Or rather you ask and test, then later on say, man, I wish I would have done something, intervene, because the sooner you intervene, the more swift you are about it, the better results you're going to have. Because then after a while, it's going to be really hard to break that cycle, because the denial of a using, because it's so now glorified sometimes and well accepted in that environment, that happens. Now, other thing you start noticing with another warning sign with just friends and family members, and especially children, is that they start changing their friends from one set of group to another. Now their best friend is all of a sudden very negative. Now they're hanging out with this other person. So you start noticing just not only one, two friends. I'm seeing like a whole group of new people. Mm-hmm. That tends to happen. That's another warning sign to look at, is this change of people you didn't even know about before. Mm-hmm.
That's a good point. Another good thing for parents to look for.
Mm-hmm.
So Edgar, I hate to kind of go back, but I just forgot to ask. Can you tell me a little bit about the withdrawal of the addiction? When people start, they have this addiction. I think that's where a lot of fear comes in, when really kind of admitting that they have the addiction and seeking treatment because of the withdrawal symptoms or what their fear is.
Now, that withdrawal question is going to take a few more of these shows to answer.
Okay, fair enough. If you can just give me a short synopsis, and I know we're going to dive into it going in a couple weeks forward.
The thing is, with withdrawals, that means that the body is ridding itself of the chemical itself. And when that happens, you're going to have a lot of different physiological, behavior, and emotional aspects going on. We're going to feel difficulty sleeping at night, changes in appetite, mood changes, trembling, shaking, some nausea, some night sweats, some nightmares. It all depends
A
on
wide range.
a wide range. It all depends on the type of drug you use, how long you've been using, your own personal biology of the drug that's going to cause this. Also, another thing is your medical problems. Any medical problems are going to exacerbate the withdrawal symptoms. So that's what you have to look at. Is just withdrawals. It's somewhat of a complicated portion when it comes to addiction. And at Crossroads Recovery, we actually do detox. So we have individuals that know what to look for.
And is it fair to say, or I don't even know if it's accurate, if you can tell me whether or not it is, the earlier you catch the addiction, the less intense the detox process is?
Think about this way. Not so much the addiction. It's more as the sooner you become aware that someone is using alcohol or drugs, the easier it is to prevent it from exacerbating or getting worse. That's where the goal is. The goal is to prevent, to become aware of where the person's at and try to stop it right at the beginning. Because once it gets down the road, it's really hard. Because now not only is the person addicted, but also has created a whole lifestyle, friends around this, and has lost connection with every other people that might help them in the recovery process. They might burn bridges in this program. I mean, burn bridges, they might not talk to those individuals that are healthy for them because somewhere or another they've done something to kind of damage those relationships. So once it gets too far on, it's really difficult. So you want to catch it right in the beginning. That's really important to understand what is an addiction. What are the signs, symptoms you're looking for to be able to prevent it, and also if you have someone that's addicted, to know that is part of the brain that has been changed and altered.
So Edgar, thank you for talking to us about really the effect on the brain and how it interferes. We can spot an addiction when it starts to interfere with their life, their commitments, their responsibilities, and how it really is a disease that sits in the brain, and the brain is altered to the individual, so they don't essentially have any control over what's going on in their addiction. Thank you for sharing all of the kind of physical and psychological dependence issues regarding the addiction. Once the family members are able to spot that their loved one has an addiction, again, we're going to go into how to approach it a little further, but if you can just give me kind of your short, brief answer to the best steps to encouraging your loved one to realize that they have an addiction and to get the assistance that they need.
Well, the first thing is this, and it's interesting because I tell parents this all the time, or I tell loved ones, when you realize that there might be a potential problem with alcohol or drugs, the first thing I recommend is conducting a drug test. Because I don't know if you know, but individuals that you've used drugs sometimes don't really are forthcoming with the information. And they might say, I've only used marijuana. And you're okay, well, don't do that anymore. But if you give them a test, you could test for five different things. You could test for cocaine, amphetamine, benzodiazepine, like the Valiums, and get a good understanding. You have to get the facts. Yes, trust in the individual, but verify with the test. And then once you have that test, you say, okay, well, we're going to test you again. If you can stay sober, they might not need for treatment. We're just going to monitor you. But if the person continues to use despite this already information, then you might want to seek some individual sessions, or you might want just to, the first positive test, go get professional help, or take them to a meeting or whatnot. But I really recommend, once you suspect your son or family member, test them right away. And if they don't want to test, that just means that they're probably using. It's been my experience when we ask someone to test, they don't want to test because they've used. They might get angry, oh, I can't believe you don't trust me. It's nothing to do with trust. Is that we know that if sometimes they could say, well, you don't trust me. No, it's not I don't trust you. It's I don't trust the drug, what it could do to you. And the test is really important for us to develop trust, to develop mutual understanding. This is what we both want for each other. And that's kind of you want to set the tone for it. So don't test to catch someone. Test is out of care concern that I want to prevent something from really bad happening. I'd rather overreact than underreact. And then all of a sudden, a few months down the road, man, I really missed on this. But I really recommend, once you have a positive test, to seek help. seek either Crossroads, call us, we'll link you to someone, or just someone in your local area, a therapist that specializes in addiction, an addiction counselor, treatment facility, because the quicker you catch this, the better it is. And it doesn't have to get down far the road where it becomes an addiction. It could be treated right away. It could be, you get better results that way. So I do recommend that test, verify.
There you go. Test and verify and help your loved one to get the assistance that is needed. Thank you for joining us today, Edgar. We really appreciate your expertise and all the knowledge that you're sharing to hopefully reach everyone out there.
Thank you very much for having me. Appreciate it.
Thank you and God bless.